What kind of a company do I want to work for?
A company that's always kind of trying to change the status quo.
If you have a good idea, you can actually get it done.
That treats their employees as they would their best friend, like human beings.
To have a bigger impact than just what's in it for them.
That is safe for me and for my community.
Giving back to the community, that's what it's all about.
I want a rainbow of ages, of genders, of colors, of ideas.
I want to work for a company where I know that I matter.
All right. Hello, everyone, and welcome to the Dell Policy Hack as a part of the Congressional Black Caucus annual meeting. My name is Paige Fetzer-Borelli. I'm the Director of Global Government Affairs and Public Policy at Dell Technologies and your MC today. Prior to this session we're in right now, we were joined by 30 individuals who were randomly placed into teams. Who are randomly placed into teams and were given 60 minutes to hack on innovative solutions around how we can create policies that promote economic justice for communities of color by making technology more accessible. The themes set out in this challenge are topics that we are continually working towards better community solutions on here at Dell, which include access to healthcare, education in a virtual world, workforce readiness, and access to technology. Now it is up to our panel of judges to listen to these pitches, to ask some tough questions, dig a little deeper, and ultimately decide which idea is the winning one. Teams will have 5 minutes for their pitches, and judges will have 5 minutes for Q&A afterwards for each team. The panel of judges making those tough decisions today are Representative Mark Vesey, Jeffrey Starks, FCC Commissioner, Binta Beard, Director of Federal Government Affairs at AbbVie, and Darlene Owens, our Head of Global Supplier Diversity Program at Dell. Before we get started with the pitches, Congressman Vesey, would you like to say a few words to kick off our session?
Yeah, absolutely, Paige. Thank you very much. Mark Vesey, Congressman for the 33rd Congressional District here in Fort Worth, Dallas, representing what we like to call the Metroplex here. And I want to give everybody a big, as we say in Texas, a big howdy. So I want to thank all of you for participating. Right now, of course, you know, our community is facing so many different challenges. And that's why we do the hackathon, is because we know that some of the brightest minds in our country have solutions right at their fingertips to be able to figure out ways how we can address these issues using very innovative techniques. I want to stop and take the time to thank Dale, Abby V, and the FCC for joining me here today. Jeffrey, thank you. I also want to thank Chevron for helping with this event, and everybody else, again, that has been a part of this. As you know, America is leading the world when it comes to the technology industry, and every year the industry helps lead our economy and expand our knowledge to make what was once impossible the norm. And during my time as a member of the Energy and Commerce Committee, Subcommittee on Communications and Technology, I've had the opportunity to look at many issues from a technology perspective and see some innovative solutions firsthand. The committee's focus is on the most pressing problems that face everything from data security to broadband accessibility to leading the world on 5G. But the growing racial disparities in this country are painfully being laid bare before us to see, and exacerbated by the coronavirus pandemic and social unrest due to police brutality and misconduct. The committee that I serve on and the subcommittee are at the forefront of creating policies, solutions that will benefit every sector, from healthcare, access to technology, workforce readiness, and racial bias in our technology. That is why today's interactive competition is aimed at hacking our way to policy solutions that can promote economic justice for communities of color through healthcare, education, workforce readiness, and trying to eliminate racial bias in AI. I'm going to continue to work diligently on the committee and advocate for unserved and underserved communities. But now it's time to hear from you, all of our constituents that all of us in the Black Caucus represent around the country. I look forward to hearing your new and innovative ideas, and can't wait to see which team prevails. And may the odds be in your favor. And again, thank you for joining us. Buenos dias, everyone. I'm looking forward to the panel again this year.
Thank you, Congressman. With that being said, we're going to get started on the pitches. So team one, once your presentation is up, I will put 5 minutes on the clock. Good luck.
All right, well, my name is Donald Williams Jr. and my partner's name was Bertram Lee Jr. And our group and team was created to solve access to technology. And so with team one, our biggest question was at the bottom, what public policies would ensure equal access to technology for all Americans, not just for educational purposes, but for remote work capabilities and other important functions for African-American families throughout the country. And so what we started off with was showing how our policy was different. And so we started off with talking about how we think there are three aspects to solve this problem as the COVID-19 pandemic has highlighted the vast digital divide, but that has hurt so many Americans and disproportionately impacted people of color. This solution is different because it has 3 points of impact that need to be answered. And so we framed everything in a question and answered it accordingly. And each aspect focuses on local community needs from a very different perspective. And so that helps make sure that this policy aims to solidify change from those various points to create the most efficient, effective, and long-lasting solution. So our first question was, what does accessible community access look like in the wake of the pandemic? The second was, how do we ensure the proper utilization of spectrum bands and promote the efficient build out of fixed broadband networks to those who do not have access? And the third was, how do we make sure in the wake of large scale unemployment that we maintain affordability for the current crisis that we are in and beyond? And so starting off with that first question of what does accessible community access look like in the wake of the pandemic, we painted a picture of what local municipalities should be doing. Local municipalities should have the ability to help solve the access needs of their community. That was the ideal goal. And so we suggested Congress create grant programs that incentivize public-private partnerships with local businesses who are feeling the brunt of not only the economic crisis, but also the digital divide. While Congress or the FCC shouldn't dictate how municipalities or public-private partnerships create these networks, there should be mandatory speed requirements that are able to be independently verified. And so we gave a suggestion, given the digital economy, of 200 megabits per second upload and download speeds.
Donald, just to let you know too, if you wanted to share your pitch, we can't see your pitch deck. If you'd like to share that screen.
It didn't share. Got you.
Thank you.
No problem. Can you see it now?
Yes, thank you.
Okay, so on to the second question is, how do we ensure the proper utilization of spectrum bands and promote the efficient build out of fixed broadband networks to those who do not have access? And so the first thing is ensuring that local providers and local organizations who are looking to solve these issues are at the forefront of spectrum access and efficient build out. So the first thing that we thought about doing is providing incentives to spectrum licensees to share underutilized spectrum bands. And our example was to create a type of tax credit to allow local internet service providers to expand service to underserved communities, especially those rural communities, either through pricing or access. Now, these incentives will encourage the larger providers to expand their access and encourage build out. As time progresses, these more efficient build outs will lead to greater competition and thereby affordable pricing options for customers. Now, thirdly is, how do we make sure in the wake of large scale unemployment that we maintain affordability for the current crisis that we are in and beyond? There is no use in creating a policy that doesn't have long-term longevity. And so our first step is to ensure that the spectrum broadband connections that have at least 200 megabits per second are part of the Lifeline program that is already enacted right now. Step two would be creating guidelines that expand the criteria for eligibility to the Lifeline program. One example is those with school-age children, and of course, meeting the other Lifeline eligibility. Now, eligibility for this program will be based on holistic factors, including socioeconomic access, work necessities, and the nature of work as it impacts the community. And additionally, this policy should encourage affordable, transparent pricing from providers to its customers. And this means inclusive pricing with no hidden fees, etc. And so how will this be adopted? This policy, as we've highlighted, will be adopted on three fronts: public, private, and nonprofit. The FCC and Congress can enact legislation or rulemaking that works with both the private and nonprofit sectors on creating these local grant programs that promote broader spectrum access. Next, the private sector can work with incentives to help promote the expansion into rural areas as that form of the tax credit. And lastly is ensuring affordability. Is ensuring affordability. This policy should be added to the Lifeline program as those citizens are in most need of internet capabilities to complete their education and work needs. Additionally, as said earlier, this policy should encourage flat rate, holistic pricing that is transparent for its providers, for its customers from its providers. And how does this solution scale? Well, this solution scales since there has been a much broader focus on access issues as it relates to largest ISPs. However, local providers and community organizations play a significant role in the implementation and adoption of broadband access. These local organizations are easier to create and more flexible than larger corporations, and as such are more responsive to the needs of their communities.
And we are at time if you want to wrap up.
Yeah, as Commissioner Starks previously stated, we should be thinking of digital divide issues as civil rights issues, and as such, every community should have their own advocate in helping bridge this gap.
Awesome. Thank you so much, Team One. If you want to take off your presentation, we'll move back to our speaker view and judges. The field is open for your questions.
Well, I certainly liked the nod there. I do think that digital divide should be thought of as a civil right. It is something that is that critical, that ubiquitous, and it must be for all Americans. I wanted to go to the idea that I thought I heard, which was making Lifeline, if I thought I heard it correctly, accessible if you simply had kids. Did I hear that correctly?
Yes, Commissioner Starks, you did. And one of the things that I think is important in kind of like contextualizing what the Lifeline program means now is that with distance learning being much more pervasive and likely here to stay, these are the kinds of subsidies that parents are going to need, right? And yes, there are issues of equity issues associated with that. Why should somebody who say makes like well above
exactly right
income have access to that? But similar to kind of like different proposals that have come out of Congress on some of these issues is that what happens is that the people who want to gain access to even more expansive or better internet access, right? They're going to pay those prices anyway. What we should do is that a larger tax credit, just like we do thinking about, or larger systems and programs like this, thinking about like tax credit that you get for having kids or being married, right? Mm-hmm. That happens and those are accessible regardless of your income because we think that is a social good. And having children have full access to what is fast and reliable internet is seen as a social good because it expands all sorts of access and expands all sorts of capabilities on a litany of levels. And also this proposal is consistent not only with your proposal and your dissent on the broadband deployment report, but also your Connecting Michigan proposal or webinar or I would say panel as well. And then also Congressman Veazey, this is also, I would say, consistent with what is happening within Texas with WISPs, and then also consistent with your legislative proposal to give broadband access to low-income minority groups during the pandemic. I think that we think that these proposals kind of can talk in concert with some of the things that you all have previously stated and the policy positions that you have had before.
Well, I'll let somebody else ask the question. That was a good counterpoint because, there are millions of Americans who would not, as Lifeline is currently structured, qualify for it. I do definitely take the point that almost any American that has kids right now, their school is in some functionality coming through virtually. And so it is important whether you're talking about E-rate, whether you're talking about Lifeline, or obviously you guys are starting to incorporate here in your proposal some ideas about affordability that are going to be important. So I'll turn it over to anyone else who wants to ask Team One here.
We have about time for one more question. I know 5 minutes goes quickly.
Wanted to ask, oh, go ahead.
Go ahead, Congress.
No, I was just going to just ask them about expanding it, and did they think that like maybe a small fee would be the best way how to pay? Like what have you thought about how we would cover the expansion?
When you say cover the expansion,
like if you want to reach a broader group of people, have you thought about the costs associated? Like
how would you pay for it? Yeah.
So Bert, were you about to say something, or I didn't want to cut you off?
So actually thinking about that, we have that within the context of the proposal, which would be a tax credit proposal specifically for the local access issues. That wouldn't necessarily cover the expansion of Lifeline, but I think depending on how the CBO scores it, which, CBO scores things however they want to score things, we think that the economic benefit would essentially pay for it itself, right? But if you wanted kind of like upfront costs, there could be a fee that we associate with that, right? With a smaller fee associated with that. Where that comes from and how that manifests itself, I'm not an appropriations I'm not an appropriations guy, Congressman Veazey, so I apologize for that. But we do think like there are unique ways to engage in the tax credit program, or what you could do is associate some small fee to be able to give broader access. Maybe thinking about it as the same way that there is the highway tax for gasoline, right? There are different ways to kind of like format this and figure out how to purchase this, but ultimately we think this is an investment in good. This is an investment for the American people. As such, that kind of investment would pay for itself over an extended period of time.
And akin to that, I wanted to say that I would think this expansion would be kind of like how we first started to encourage the increasing use of solar panels on people's houses and things like that. And now solar panels are cheaper than ever after people have received those credits. They put those solar panels on their house. They've had to pay that cost up front, but the money they receive over that time is indicative of that growth and that use. And so it is definitely, for the companies, something that I think we should put into frame or reference how we started to push and encourage the adoption of solar panels for businesses and consumers themselves.
All right, team. Thank you so much. I'm so sorry to cut you off. I know it's a huge topic, and I just wanted to remind the judges that these teams only had an hour and they still came up with all of this. So I'm so excited to hear Team 2. If you're ready to pull up your pitch presentation, I have 5 minutes on the clock.
Can everybody see the deck?
We cannot see the pitch deck.
Okay. It was on for a moment there.
Yeah, it was. Yeah, there it is. It's back now.
Yep, now we can see it. Thank you.
Excellent. Let's get this thing on the road. Okay. Hello, my name is Kyle Blygen. I'm representative of Team 2. Our job, we were tasked with providing a policy initiative that can provide cost-effective, accessible, and quality health care to reduce racial health disparities that exist in African American and minority communities. So we recognize currently in the status quo healthcare infrastructure that putting up a website is not enough. We had an individual in our own presentation group that recognized that he had an injury during COVID-19 and he was trying to gain access to telehealth facilities in the status quo. And oftentimes when he was conversing with his telehealth provider, they were telling him to access the website. And we recognize that millions of Americans, whether in an aging demographic or minorities across the country, they need more culturally competent care through telehealth, and that's what we're going to provide. So in order to provide this, recognize there's 3 challenges. One is a lack of education types of telehealth that is currently available. There's a lack of familiarity with different forms of app and technologies through online platforms. And there's definitely a lack of culturally competent healthcare professionals that are made available through telehealth. So therefore, our solution will increase 4 goals. It'll increase access to telehealth. It'll facilitate adaptability to telehealth programs. It will become cost-effective, accessible, and provide quality telehealth care. And it'll be culturally competent and provide an equitable approach. So what is our solution? We focus on access and adaptability with a culturally competent approach. Through a partnership with the FCC, HUD, HRSA, and HHS, we specifically recognize that the FCC will provide a public-private partnership, oversee the expansion and access to broadband care, broadband access to minority communities, and survey the landscape of underserved communities. The FCC already has current initiatives on this that do this on a very, very large scale with the rural side, but I'll talk about our nuance later. The Health Resource Services Association will provide the competency training, not only on the medical side, but also on the user side, to ensure that individuals through a large social media and online presence are able to access telehealth regardless of different cultural competencies or different barriers that maybe the elderly population may have to overcome in order to gain access to these online services. Then through the Health and Human Services, they will provide the telehealth services through either Medicaid or Medicare, partnering with also states, or provide a tax incentive to allow the private sector to develop an AI solution or a comparable solution that can work in conjunction with the government paid for services. How is this novel or different? So we recognize at the beginning of this month, HHS, FCC, and USTA announced an early partnership that wants to expand telehealth to rural parts of the country where healthcare access is challenging. Ours is a little bit nuanced, right? We combine the Healthcare Resource Services Administration along with HUD so we can get more accurate geographical understanding of where minority communities are in urban areas, because according to Pew Research, more than 54% of minority communities still live in the urban landscape, but are one of the largest minority demographics that still are lagging in their interaction with the internet. And so through that partnership, we will expand telehealth to minority communities that face barriers to telehealth due to socioeconomic status, varying cultural competencies, and an aging population. How will this be adopted? We recognize this plan has large interagency operability already. Through the FCC Connect to Health Task Force, they will create a minority telehealth group that will expand broadband to underserved areas and minority communities. Through the Health Resources and Services Administration, they will provide competency training for technological adaptation for all on the user side through the National Telehealth Resource Center program. How will this be adopted by the private sector? Well, we're specifically recognizing the partnership between the HHS and the private sector. We want to levy the best practices through face-to-face interaction for maybe the aging demographic that still needs to see their nurses or their doctors, but we also want to power and unleash the technology sector to do what they do best, innovate through machine learning and AI. The NIH specifically states that the next groundbreaking development in telehealth will come through chatbot technology and machine learning. We want individuals to access telehealth online through multiple languages, being able to, better than WebMD, actually assess what their symptoms are without thinking they're going to die by using machine learning to provide them with the care and information that they need. We recognize that the private sector through big data companies already have these services that can be more intuitive to the actual user's needs to provide more equitable access to telehealth. So we recognize that our conclusion will require broad interagency coordination and will require strong private and public sector collaboration, but we believe through our 4-agency multi-pronged approach, we can provide those cost-effective, equitable, and competent telehealth services. Thank you.
Right on time. Thank you so much, Team 2. All right, if you want to take off your screen sharing. Judges, any questions?
I wanted to ask very briefly if he could talk a little bit about, I thought that was like really fascinating. You know, one of the issues that we've had with AI is some of the racial bias in AI. You know, again, if you're going to use this technology to be able to help communities of color receive better healthcare, have you thought about some of the biases that are in AI?
Yes, 100%. So I guess the AI will operate on the user side. It will not be a surveying practice that assumes any characteristics of the user before they're entered into the medical platform. So for instance, any individual will have a race, I know this is used often, but it will have a race neutral approach. We will utilize artificial intelligence to best assess what the conditions are and the best access to care for an individual. So this will come through dialogue and machine learning. So if an individual states on an app or through the website that the HHS provides, hey, I have a headache today, or I'm experiencing flu-like symptoms, the artificial intelligence will be able to provide a list of services similar to how you would go through an option course on WebMD to best hone into what the actual need for that individual is before they transition into the care before the doctor, allowing the nurses and the doctors to already have a larger bed of a larger survey of what the potential diagnoses could be before they begin in the virtual process. So it's not on the service discrimination end on the back end that allows large technology companies to survey and discriminate against individuals. The artificial intelligence serves as a bridge to bring the individual who's in need of services to the actual nurse or the doctor.
Yeah, thank you.
I want to defer to one of the other judges if they have a question.
I did have a question. First of all, so far the two presentations, I'm very impressed with what you guys were able to do in such a short amount of time. With this presentation, I appreciate really bridging the disparity in urban communities where people can be right next to premier health facilities, but that doesn't mean they have access. A question in terms of how you started is like people are sent to a website, but you can still have challenges in people even connecting to it. I feel like in the presentation, I still wasn't quite seeing how that chasm is bridged of how you actually get someone to then access this capability.
Okay,
I think that's exactly right, Binta. If I could riff off that, one of the things that came to my mind is very much seniors who have been acutely harmed during the pandemic. In particular, they also are not as digitally literate as a lot of folks that can hop on their smartphone. Only 53% of seniors have a smartphone. It is, I agree, one of the things that needs to be further fleshed out about this idea. I thought this was a tremendous presentation, is actually helping folks get the skills and the literacy that they're going to need in order to effectuate the care that they want. But I'm just riffing off of the question that Binta asked.
That was my question, as well as the access to this for the seniors.
Yes. So specifically for the seniors, and this is like, I guess the limits of the time. But this is why we were relying heavily on the training programs that the National Telehealth Resource Center already offers. So they are already creating programs that will foster the use of telehealth technologies to increase access to an aging demographic and to overcome racial competencies. And so we recognize that Telehealth Resource Center program is oftentimes listed, but when we were looking through specific executive actions or how agencies were deploying it, they weren't deploying it effectively. And so we specifically wanted to partner with that agency to provide a social media campaign, specifically during the time of social distancing, or a coordinated phone bank or email coordination campaign to make sure that people not only know through their service providers that they can access this care, but they can actually begin to speak with someone one-on-one virtually about how to get onto these platforms. And that would be the agency through the HRSA that would be doing that training.
Thank you. So I hate to cut this conversation off too, but we are at time. Judges, I can already tell that you're going to have a really challenging time deciding to pick one project. So with that being said, Team 3, if you're ready to share your pitch deck, they have 5 minutes on the clock.
Hi, everyone. My name is Evan Morton, and on behalf of Team 3, we will be tackling the problem of education and the digital divide. So our problem is looking at how there are many students, specifically students of color, that do not have access to the internet or to laptops so that they can do their homework. And this problem has definitely been exacerbated due to COVID-19. So we are trying to figure out an innovative way through policy to solve this digital divide issue in order to give more access for laptops as well as internet access so that students are not left behind and they are able to complete their homework assignments and be engaged in their classes. So how we've come up with our solution is really focusing on giving more responsibilities to state governments instead of putting all of the weight of this digital divide issue on school districts. And so we're looking at this problem of seeing school districts having a lot of responsibility of providing laptops and providing internet access, and especially during the pandemic, of having this huge problem being thrust on teachers and school districts to try to figure out what to do, especially for students that don't have access to these things. And we have also seen that there has not been a very good direction in handling this issue, and that it has been exacerbated by a pandemic. But we see that in order to help solve this problem, the responsibility should be put more on the state governments and more of the corporate partnerships and access that they have rather than with school districts. We also see with the digital divide that many students are given laptops in this issue to help them, but if you have a laptop but don't have internet access, that really doesn't solve any of the problems. And we think that states can use policy to incentivize companies to help with this digital divide. And the digital divide within the United States has several components, including access to internet connected devices, access to up-to-date repair for laptops, and also access to reliable high-speed internet. And so with our solution, we want to help increase the responsiveness of students and improve online learning by closing this digital divide gap. So our policy solution will be adopted by creating policies that make states required to ensure internet access in every home and requires every student to have a laptop. And in order to adopt this policy, we are looking at creating partnerships with Dell Technologies for laptop donations, as well as partnerships with internet providers. And this would be in a type of partnership of corporate responsibility that would be a combination of state and corporate funding, so states could match some of the funding that corporations are able to give. And in order to execute this solution, we will work with school districts because they will have a lot more of the knowledge of what the students need. So we will work with the school districts to provide data on how many students need internet and need laptops. We will work with the school districts to distribute those laptops because, again, they will have that local information to know who the laptops need to go to. And they will also be responsible, but the school districts will not be responsible for the laptops. Instead, that will be through the corporate partnerships. And how the solution could scale, we really see this as a way to increase better corporate sponsorships in providing scholarship and internship programs that will allow the students that participate in this program to close the digital divide. They will end up being able to have internship and possible employment in the future by the students that participate in getting the laptops and internet access. And this, by creating this kind of pipeline of employment in the future, it could also help states and companies to increase their diversity in technological fields. Thank you.
Thank you so much. Okay, judges, about 5 minutes for Q&A.
A couple thoughts came to my mind. The first is, as you said, we're really talking on this issue about how to get connection and how to get connected devices. A recent McKinsey report showed that, in particular on communities of color and Black and Brown, students are going to be at least 10 months or more behind. And so this is an issue that is imperative. We need to figure out also how to teach better online, better virtually. The issue of truancy as well, for lack of a better term, especially in communities of color. The failure for students to actually log on is just is something that we also have to pay attention to. The last thing that I mentioned really quickly, because I don't think I heard anything about it, is we can't also forget about our college students as well. I visited with a number of HBCUs and some of their presidents, and there is a lot of need there as well, and in particular Pell Grant students, who are some of the students that come from the lowest income homes. There's a K through 12 issue, and then there's also making sure that for a lot of college students that are as part of the diaspora back home, making sure that they're connected as well?
Yes, I think our focus on corporate sponsorships or and corporate partnerships could help with the issues that you brought up, especially because there is a difference between K through 12 and college, but possibly creating this pipeline of the students that use the services for laptops and internet access, creating an internship and scholarship partnerships with these corporations, and creating this new pipeline of diversity into technological fields in the future. That could be a way to solve the problem both through K through 12 and especially in college with providing internships in a pipeline to future employment.
I have a question if no one else does. I appreciate in your presentation that recognizing that this was an issue even before COVID and it's just being exacerbated, but in and of itself, this is a huge issue. A question I have is, given the focus on industry in making the donations of computers and helping to build the internet infrastructure, what are some of the challenges you think you could encounter with that, and what would be the argument you would say for why this is a role that they should play?
Well, we've thought about donations because we knew that's a big question of how this is going to be paid for. And especially during a pandemic, we didn't think that it might not be appropriate to, raise property taxes or find other taxes to raise in order to pay for this. So we felt that especially a large corporation like Dell could help to, and they already produce laptops, so that could be an avenue to solve that issue. And we're hoping also that with creating these internship opportunities and employment opportunities in the future, that it would be more of an investment from the corporations and also the internet providers, that they could see that they are it's more of an investment in that in the end, that they would reap the benefits of having more diversity in their workforce. And as well as in the beginning, having this, we would need funding from the states, but they would be matched with the corporations. So hopefully having that partnership will help ease some of that difficulty.
We have about 1 more minute if judges have any other questions.
Yeah, I thought that I'm a Texas parent. I was interested that you have Texas stats on there, and our school district is minority school district, majority free and reduced lunch, and every kid has a hotspot. But you wonder about the connectivity that they're getting, and didn't know if you had thought out the connectivity piece. Is there one piece of that that's more important than the other? The connectivity versus access versus updated equipment, but you think that that needs to be addressed?
Yes, all of them need to be addressed, but I think our main policy solution is that state governments would require reliable internet access and in every home, and they would require a laptop for all students. So in that requirement, we would hope that would be reliable internet access, and that would create this corporate partnership with internet providers. That would be a part of that agreement, that that access and the connectivity needs to be monitored and made sure that if there's an issue, that it is fixed quickly.
Thank you. Yet another incredible presentation. I have enjoyed hearing these conversations so much. So again, I'm so sorry we don't have more time. But for our final team, Team 4, if you are ready to share your screen, you have 5 minutes for your pitch.
Okay. Hi, everyone. I'm Josh Kumar, and I work with my partner, Jessica Martinez, for the goal of trying to work with workforce readiness. So our prompt was trying to deal with how closing the racial wealth gap that exists between African Americans and Caucasians, and also taking a look at how a lot of companies are investing a lot of money into AI technologies and automation that is expected to significantly increase productivity, but also decrease the workforce. So what kind of public policy can we make to try to increase technical skill building and job opportunities? So currently, we wanted to take a step back and discuss why current retraining programs continue to fail. So this is a quote from The Atlantic, why is the US so bad at worker retraining? And says, such programs have historically been unable to change an economy in which low-wage workers suffer from both low pay and lack of autonomy. Initiatives struggle for several reasons. Those who need the training typically don't know about it. 2, course material tends to be disjointed from the needs of the employers. And 3, job training programs don't force employers to pay skilled people decent wages. So when we take a look at why our current workforce retraining methods are failing, this allows us to come to a better conclusion about how we could possibly make them succeed. Now, if we take a look at some of the previous approaches to altering the workforce and integrating technology into them. The High-Tech Act of 2009 turned the relatively obscure industry of healthcare informatics into a major industry. So just for reference, the budget of the Office for National Coordination for Health Information Technology was created in 2004 with a budget of $1 million. And in the High-Tech Act, that budget was ramped up to $25.9 billion. The interesting about the healthcare informatics sector is that all this money was originally appropriated for the mass implementation of health electronic records. And that led to a large hiring of workers who had healthcare experience, even though they might have lacked the technological experience, because they knew the sector and they had credibility with their peers. And this created a bunch of the innovations that we are currently working on to try to implement today, such as telehealth, health assurance models that are focused on trying to keep people healthy rather than have them deal with the acute points of care, and allows for greater approaches of innovation within the sector. So what our proposal was to try to create a high-tech act for the wholesale retail industry. So the wholesale retail industry employs 19.8 million workers as per 2019. The makeup of them was 18% Latino, 5.7% Asian, and 11.7% African American. So this is an industry that looks like America, and boosting this industry, particularly during the time of the pandemic when a lot of them are facing cuts, would be a great source for job creation and allow for an increase of retooling the industry to a more technologically focused approach. The beauty of the High-Tech Act was it didn't completely transform the healthcare industry by forcing the healthcare industry to make changes. It created a hybrid sector that was able to provide these new jobs and allow for the dignity of work to be imparted onto the workers within the healthcare industry. So what our approach would do would be the exact same thing. That way we're allowed to take people who have retail experience and turn what we traditionally see as a low-skilled job, even though one might argue if that term is appropriate, into an asset. Because they're not just people who work in the retail industry, they're people who have experience and credibility and can leverage this experience and credibility for better paying jobs. This also allows for organic growth and innovation within the sector. So we'll be able to boost the retail industry in a climate where it's being negatively impacted by an economic downturn. And like we said before, it features a lot of minorities and a lot of people who do not traditionally have the wealthy backgrounds who are working in this sector. And this solves the issue that we typically see with workforce training programs. Now, in terms of adoption, we could appropriate funding through the House and Senate Appropriations Committees. We can also create an Office of National Coordination for Innovative Technology. This would be in the Department of Labor. This is similar to what was established in the Department of Health and Human Services. And we can offer the grant money to be distributed to companies who are able to meet a meaningful use benchmark, where a company is able to prove that they're able to create jobs and boost productivity and therefore can get funding. So the solution can scale based on the efficacy of the act, and we can examine which grants and programs will creating optimal outcomes that can be prioritized in the future. We can use the new office that we created within the Labor Department in order to adjust the program at its onset in order to maximize efficiency and make sure the resources are being distributed appropriately. And
awesome, right on time, thank you. Okay, judges, I want to make sure our Q&A stays at 5 minutes so you have time to deliberate since we're nearing our end time. So any questions?
I had a question. Obviously the future of work is incredibly important. A lot of folks were thinking about this very heavily. before 50 million Americans got laid off and are currently on unemployment assistance. You know, one of the things that I briefly wanted to touch on is you guys got a really hard kind of vision board quest, because in my mind, I think you're really trying to solve for three problems. It's, you know, for our young people, what are the jobs of the future going to be? And then for folks that are middle age, let's call them 18 to 24, what are the jobs of the future going to look like for them? And then you're talking about, you know, for what I like to say, grown folks, what are we going to do to retool and reskill them there? What I wasn't really, you know, what are digital skills? Some of the things that we've heard about trying to make sure that folks are able to retrain, reskill, potentially teaching them computer programming. I like the kernel of your idea, but I'm not sure I fully tracked, you know, how this retail reformation is going to be executed. Maybe run it by me one more time, or is there a digital aspect to it? Or how are we going to repopulate these 20 million folks that you're talking about?
Yeah, so yeah, the 5-minute timeline was a little restricted in this case. Basically, what we're trying to model is focusing this on the grown folks like you were talking about. And what we were looking at is the innovations that happened within healthcare happened because you had companies like Cerner and like Epic that were able to take their jobs and then take advantage of the funding that was being distributed and massively expand, and then implement their own systems within different hospital networks. And then people were trained and certified within their own systems there. So this isn't just like teaching people how to do Java or like Python. This would be trying to spur that initial version of innovation. So retail stores are able to adopt more like mass digitization. And then from there, people with retail experience would be valued as potential employees to work and learn these systems and teach it to their peers.
Got it.
Okay, are there any other super quick questions? Sorry to be short on time. Okay. So now that we have heard all four of the presentations, judges, we are going to send you into the breakout room where you can talk through these ideas, deliberate a little bit, and then we'll pull you back into this room after about 5 minutes to announce the winner. And they're off. All right. So while we are waiting, we pulled one of our videos we wanted to show you to kind of give you a bigger picture around this policy hack. So the policy hack is something that we've been doing at Dell around the globe for the past couple years as a way to cultivate these conversations and bring together a meeting of really great minds. So we thought it would be fun to be able to show you an example of some of our policy hacks that are a part of our bigger initiative.
We put together teams of entrepreneurs, investors, policymakers, corporate innovation people, and they hack that challenge, they pitch, and then the best solution is the one that wins.
The winning team of the policy hack will actually get more work because we intend to enact the winning idea and incubate it over a 12 to 18-month period.
Through the policy hack in 2017, with this entrepreneurship education idea, we worked through private-public partnerships, including Televisa Foundation, to develop Emprende Héroes. We helped implement the program at the schools to help develop these young entrepreneurs.
We put policymakers in an agile, dynamic environment that typically startups find themselves in.
There are a number of areas of alignment between Dell and the government. Emerging technologies is one of them. We have a huge interest, as does the government, in effectively and efficiently providing services to the population at large.
to come here and get a chance to see a large Fortune 500 company here in Las Cruces is great. They provide so much information to us and allows us to really expand a lot of our thinking.
Estamos promoviendo el desarrollo de nuevos proyectos con tecnología. Estamos apoyando a nuestro país. Es bien importante el compromiso que tiene del EMC México.
During the policy hack, most of the ideas were not asking for incentives from the government, but the allowance to implement projects that will go across several areas of the public organization, tackling some of the social issues we have in our country.
I love this initiative of the Dell Hack. It has changed me as a person.
You feel enriched, you feel part of a big platform, and your ideas are being honored.
If companies like Dell partner with the schools, we would really take this project forward.
With these initiatives, you feel alive again. You're thinking about new solutions, which is just perfect for the new world that we're going to build.
All right. So this is what you guys have been a part of today. But actually the digital divide is a newer topic that we've been hacking on, and I've just been so impressed by your presentation. So thank you again for coming to participate. And I got notification that our judges are going to be heading back into our room in just 60 seconds. What did you guys think of the event? Was it tough to do over Zoom?
Yeah, it kind of was, but it also had its advantages, I would say. But it was a give and take type thing, because usually when you're in person, you know, you can kind of sit and collectively work and write, but at the same time, because sharing a screen, because me and Bert were thinking, it would have been nice if we had typed this in a Google Doc, so that way we could be working on it at the same time. But it was overall, it was still solid.
I was not anticipating how much I would sweat because of this and how nervous I would get. So I appreciate that.
Awesome. All right, judges, welcome back. Sorry to also force you to decide so quickly. I can only imagine what your conversation was. So I will let you all take it from here. We'd love to hear who you chose and why and what went into that decision.
Yeah, well, first of all, let me thank all of the judges for participating. And I know that their time is very valuable, and just want to thank each and every one of them for taking the time. And we had a great, thorough discussion about which one we liked the most, and decided on number 2. Any other judges want to add into that at all?
Yes, you know, I wanted to say as well, I was extraordinarily impressed with all of the teams, like everyone else here, making sure that issues of diversity and representation in the tech and telecom sector is something that I think long and hard about. I know the congressman and all of us in industry, public service, we're all thinking about these issues. And what I saw today was truly extraordinary. Each and every one of you has a bright future in this space, and I can see it quite clearly. And so congratulations to all of them. The issues of access, issues of education, of health, and of course, like I said, trying to see around the corner on what the future of work is going to look like. These are huge issues that we are all going to be working on for the future. Great work to everyone. I thought team number 2 had a very well fleshed out presentation, and in particular, how to handle some of the seniors issues, as well as some of the AI issues I thought was critical.
Pinta, did you want to tell us a little bit about what went into your thought process?
Really impressed. I mean, just that you guys put together those slides so well and so quickly, and on top of that, just how well you thought out the solutions on these really important issues, both as they relate to COVID and pre-COVID. It was not an easy decision, and I wish you guys could have actually heard our discussion and heard how we talked about your presentations, because you really gave all of us something to think about.
So with that, we have 1 minute remaining, and I just want to thank our judges for joining us today. And a big, big thank you to all of our participants for being so flexible, collaborating on Zoom, and bringing these incredible insights and ideas to this policy hack. Team 2, we will be reaching out because, as you saw in our policy hack video, the work for you has just begun as much as you're willing to work with us. So we'll be reaching out with you to continue the conversation. And everybody, thank you so much for the participation.
Thank you. Appreciate everybody's participation. This was great.
Well done.
Thank you.
Everyone.